Welcome, everybody. I would like to start with a simple land acknowledgement. And this is a really different one. This is one that was written by an Ojibwe author. And I thought because our BPW president is with us, it might be a good one to have. For you today, my friends, I raise sacred smoke. For you who are troubled, confused, doubtful, lonely, afraid, addicted, unwell, bothered, or alone, I raise sacred smoke. For those of you in sorrow, grief, or pain, I raise sacred smoke. For those who work for people, for change, for spiritual evolution, for the upward and outward growth of our common humanity and the well-being of our planet, I raise sacred smoke. For those of you in joy, in the glow of small or great triumphs, who live in love, faith, courage, and respect, I raise sacred smoke. And in the act of all of this, I raise it also for myself. And I would just like to say that Angie, our BPW Canada president, is, I think, almost devastated that she could not join us, but she's been ill for this is the third day, and it's a really bad cold. It is not COVID, and she's in bed trying to get better because tomorrow she is supposed to be at a gala because she has been honored with an award for volunteering, for her volunteer contribution in her town. And like the perfect woman she is, she says, I even bought a new dress. So she's really hoping she can go because she's got a new dress. Perfect for us.
That's the perfect woman for you, Norma?
Well, it seems that's the woman in us. It's always, I've got my new dress. I have to wear it somewhere, especially where I was planning on going. I want to say thank you for everybody to come today because this is the last of the 3 webinars that we have. And I want to welcome Stephanie. And I'm going to talk a little bit about Stephanie before she begins. So Stephanie, she's got a PhD, an MSW, and an RSW, and I know that's all social work degrees. Joined the Factor Inwentash Faculty of Social Work as an assistant professor in July 2017. And I'm going to say that's at the University of Toronto. Prior to this, she completed doctoral training at the University of Denver Graduate School of Social Work, where her externally funded dissertation focused on family planning attitudes, experiences, and social network influences among youth experiencing homelessness. Stephanie also served as a co-PI on a federally funded US grant which sought to develop technology-enabled innovations for reducing teen pregnancy through the use of human-centered design. Her current research focuses on improving the health and wellness of equity-deserving youth, with particular attention paid to youth reproductive and sexual health access, education, and outcomes. Her practice-based experiences in family planning, policy, and community organizing inspired her career in social work research and teaching. Stephanie's research contributions have been recognized through awards received at academic conferences, including the North America Forum on Family Planning and the American Public Health Association annual meeting. Stephanie co-founded and co-directs the Youth Wellness Lab at the University of Toronto, a youth-led hub for research and advocacy. She is also cross-appointed affiliated faculty with the Monk School of Global Affairs and Public Policy, University of Toronto, and the University of Toronto School of Cities, and an instructor with the University of Toronto Centre for Critical Qualitative Health. I told Stephanie I was going to shrink that, but I'm amazed. And I'm going to say, when I spoke to Stephanie, when we were planning for this event, we just talked and talked and talked, and it was so great to hear about everything she does. And she doesn't know this, but I'm going to put her on the spot. Stephanie, they know I'm going to do this to you, but I'm going to do this to you. So I thought before you begin your real presentation, maybe you can answer this for us. You've worked in the US, you've done lots of research in the US, you've worked in Canada, you've done lots of research in Canada, and I know that your most wonderful project that you love right now is working with the youth through the University of Toronto. How do you find, just really shortly, the differences between the American youth and the Canadian youth when it comes to this issue?
Well, thank you for having me, everyone. This is amazing. And it's amazing to see people coming together across Canada in community with each other to advance change when you don't even necessarily have to as part of your efforts, as part of your work. Like, that's maybe the overarching difference that I noticed as I was thinking about this. I don't know that a group like you would exist in the US necessarily, like that you're using your time unpaid to rally around and learn about and have discussions about a topic that maybe isn't necessarily core to what you're doing in your day jobs or your efforts. It really shows just such a commitment to civic change. And so I appreciate that. On the front of youth, I think that youth are similar in some ways everywhere in that they want to have a voice. I think we consistently see, or almost that we're confused when, oh, we built all of these things to try to help young people and then they don't work, and we're astounded, like, why didn't they work? And it's probably because we didn't ask youth in a meaningful way to be involved in the design and the decision making for those systems that ultimately then failed them. So I think that's the same kind of everywhere, so that we don't engage youth in a meaningful way and in incorporating their voices and allow them to ask questions and direct decision making about the systems that then go on to usually fall short and how they are helped. But I think that there are some other differences. We've always just felt in the US that we're playing defense and that it's just a matter of time before something terrible happens, just as it did with the overturn of Roe v. Wade through the Dobbs decision. But I think that we can't be complacent here in Canada. This is not something that's a constitutional right. Thinking about abortion access specifically, I guess, as I'm speaking of this, but rights get chipped away in their various forms everywhere. So I think that there is a lot more access, and we have a universal-ish healthcare system here, which does, I've seen in comparisons, impact how people are able to access resources and supports much better here. But there's a lot of work to be done, and there are still a lot of people left out along the way. So it's a little bit of now people who care and who are impacted are playing a lot of trying to play offense and defense in the US, but I think we don't need to get into that situation here. So we have to be as proactive as possible.
Thank you so much. That's great. Not that we think we're better in Canada by any means, and you're right. When you hear some of the news, you realize how much more work we have to do.
Well, and I think like I find myself, I used to joke about it, sort of apologizing as I moved here. I was like, oh, I'm American, sorry. Because it was a difficult time that I moved here. And now it's a difficult time in different ways. So, I think there are a lot of amazing things that happen here. And I've been, it's a lot of why I'm here, honestly. I can do work, I can do research that is honestly, I don't have to fight with funders. I don't have to explain why this is an important issue here in Canada, and I'm literally not allowed to write the grants that I write in the US. So I'm super grateful to be here nonetheless.
That's actually a really good comment. We always think that it's maybe hard to get money to go towards certain things, but to hear you say that at least there isn't as much pushback as there can be.
Not even close.
Thank you. I think everybody's muted. And Stephanie, do you want questions during your presentation, afterwards, or? putting the
I'd prefer to keep things really conversational. In fact, I tried as an instructor, I try to have visuals in the form of like a PowerPoint just to guide folks, especially who are more visual, and to organize my own thoughts. But please do just jump in with anything. There are so many things I could speak about on this topic that it was hard to even narrow and decide what I was going to share here. So please jump in. There's so much more. I could spend years speaking about this topic, or these topics rather.
Great. Carry on.
All right. So I am going to just, in an effort to organize my own brain, which is a difficult enough rodeo on its own, just seek to share a little bit about some of the work that I've been doing lately. And I'll try to weave through a number of different things. My focus is definitely on youth first, and also all things reproductive justice. I didn't even understand what social work does until much later in my career. I worked as a community organizer and policy analyst for Planned Parenthood of the Rocky Mountains in Colorado, where I moved here from, and where I spent most of my adult life up to this point. So I was doing work in the community, fighting for and against certain forms of legislation on different aspects of contraception and abortion and teen pregnancy prevention and comprehensive sex education. And it wasn't until that I'd worked in the community for quite a while that I realized that social work is a much broader field than I had realized. I think I had a very narrow perception that social workers were maybe child welfare related, or they were working as school social workers or hospital social workers. And those are all really important and amazing roles in their own right, but it wasn't work that I saw myself doing. I saw myself being really interested in structural and systemic change as someone who likes to think about policy, and I liked working in community with people. So as I was doing my work in the field, I realized that there were all these amazing people with really interesting jobs who also said, oh, I have a MSW. I learned about that in my social work program. And then it caused me to learn in going back to school. I could never really find the thing that I wanted to go back to school for. I knew I wanted to go back to advance my skills at some point. But for me, it was never about like, I don't want to just learn something simply because it's interesting. I want to learn about something because it's interesting, and then I can do something about it in the community. And social work allowed me that space to learn about something, learn about the research, the policy, the practice-based things that we need to know about in providing services by, with, and for folks, but also what are we going to do about it? It's not good enough that it's just interesting. Like, where's the action that comes from that? So that prompted me to go back, and then I fell very quickly into this vortex of realizing that I loved both teaching and research, and went on to the PhD program, and the rest is history. But the whole time, my focus has been on the two things that I worked in, which was reproductive justice and with a focus on youth. So I'm just sharing a little bit to start the conversation here, and do feel free to jump in. This is a quote as part of the title. My initial instinct is to listen. And I think that's just so important in all of the work that we're doing in community, and as we're trying to redesign systems by, with, and for people, that we're just understanding where people are coming from and not leaving voices out of redesigning the system. So promoting justice, reproductive justice with, and particularly equity deserving youth. And so I use that as a sort of a phrase that says that we have many multiple intersecting and marginalizing identities and lived experiences, and that for each one of those intersecting experiences and identities, the stakes get higher and the inequalities deepen. So that's really who I've tried to foreground in the work that I do. So just as a little bit of background, I don't want this to be so academic, but just to give you a little bit of a frame, youth really face such an array of injustices in terms of pertaining reproductive and sexual health care, in terms of their rights, and many will forego altogether seeking services and supports because of because of experiences they've had in being really stigmatized, not being affirmed, and not even accessing care that's appropriate to their needs. I'm thinking especially with gender affirming care, and just meeting providers who don't necessarily understand or even seek to understand what young people are going through. So this applies really to the youth that I'm doing most of my work. A really large part of my work has been to explore a lot of these topics with youth experiencing homelessness. But by way of that, that's also really exposed me to overlaps with, a number of people who experience homelessness, also have histories of child welfare. Perhaps they age out of child welfare systems and then subsequently experience housing precarity. About at least in US samples, I'm not sure as much here, could be similar, it would depend on the study, but about 40% of the young people who I worked with who were experiencing homelessness identified as 2S LGBTQ plus, and certainly there are racial disparities in all of these identities and have lived experiences as well. So that's just a bit of a backdrop. There's so many intersections with homelessness, with poverty, with really just that we don't design things for young people with any respect for them because of age, kind of youth, what's the word? Adult-centric, ways of thinking. Then it's like, oh, you don't know, you're too young. You don't know what you need yet. So we design a lot of things that results in a lot of unmet needs for young people. So among, speaking specifically to those who are unstably housed or homeless, 30 to 60% of pregnancy capable young people become pregnant while they're unstably housed or homeless. And compared to people with more stable housing, pregnant underhoused youth are far less likely to receive the resources and supports that they need in terms of their health care. And this can impact their own health dramatically, as well as the health of their potential baby or child, or even whether that baby is born due to health complications and other reasons. And research has really consistently shown that underhoused young people face considerable challenges accessing medically accurate information. They don't necessarily know where to go. Perhaps some have been in and out of school, so that 1 or 2 days that they got information about sex education, if they missed that might have been their only entry point to knowing some of those things. Maybe there weren't conversations at home because home was an unstable place as well. And after that, just being judged for the mere fact that they're underhoused. There are a number of healthcare providers through research that have shown to treat people differently because they perceive someone as maybe lesser than in some way because of their housing status. So this has impacted contraceptive care, abortion care, judgment around sexually transmitted infections. Parenting supports. A number of young people identify that they'd actually really like to become a parent because in some ways to address some of the impacts of really unstable family lives. They want to create their own new family and maybe have a supportive family that they create of their own after not experiencing that while growing up. And then if you take all of these things and layer on gender and sexual orientation, gender identity and sexual orientation, it magnifies even further. I think there's a myth that, young people who are maybe not heterosexual identifying, they're not going to become pregnant, but that's very untrue. The rates are just as high, if not higher. And because of the unbelievable conditions that people face while living on the streets, they're often, then my dog is barking in the background. This is Zoom life. But then thinking about what people have to do to survive on the streets and while underhoused, it doesn't really actually matter what one's preferences are. People are doing things to survive. Trading for different basic necessities, and sometimes this means trading sex for such basic necessities, and that can clearly result in pregnancy or STIs and a number of other challenges. So all of this really applies to youth in care, to 2S LGBTQ plus youth. And we really lack interventions as well that are tailored to youth's more specific needs. Thinking about youth with disabilities, I work with youth with neurodiversities. We really just have not scratched the surface in interventions and supports that are tailored to youth's really specific needs. So all of this is to say there are so many difficult things that are happening in a range of different youth groups and populations, lived experiences and identities, all of which I would argue are a violation of basic human rights. And that it's just so sad that in a country that, what are we, like the 7th richest nation in the world in Canada, something about like that. And with a system that I applaud and especially applauded coming from the US that did not have, did not make an attempt at universal healthcare in the same way that Canada did so much earlier. There's still a lot of people left out, and there are still, even if you have technically access to a lot of services and supports, a lot of people just don't want to go through the shame and the stigma and the judgment that they face in those environments, in seeking information and supports. And even thinking about, how, like, say here in Ontario, even if you have OHIP, if you're a youth experiencing homelessness and you had to flee your family because of violence and the threat of being in your home, how you access care. I don't have my ID. I don't have my OHIP card. I don't have identification. I don't know how to navigate this complex system as a young person. There are so many layers that we kind of just take for granted that make all of this really difficult. So this just kind of builds a bit of a house of cards for people with, especially with multiple intersecting marginalizations as part of their identities and lived experiences. I'll kind of skip over probably all of this, but like none of this really leads to good things for people's mental health either. Certainly impacts self-esteem, loneliness, feelings of hopelessness, especially after being disrespected and dismissed and dehumanized in so many ways. And though there haven't been really many great tailored interventions and supports that are built for youth based on their identities and more specific needs, there has been a call increasingly about using more of a reproductive justice, more of a holistic approach, that it's not just about abortion, it's not just about contraception or preventing pregnancy, it's about the conditions in which people are living. What do we do to address community violence and poverty and immigration status? And there's so many layers to this that no person's existence is really about one thing. So I think reproductive justice as a framework and as a movement is a nice way of showing that neither are these issues. It's not just about one thing. And I know that you've had discussions about this and with other speakers here along the way. So this is particularly impactful for young people who are not about one thing either. There are, however, on a more hopeful note, and I'm just checking on the chat here. I'm just trying to get a doctor. Yeah, so many layers. Sorry if I'm missing the chat a little bit late there. Just even trying to navigate, like, how do you even find a physician? Of course, it's a really good point. That said, on a more hopeful note, not everyone's terrible in their service provision. That's certainly, we hear a lot about, I felt judged and I felt stigmatized. There are a lot of people who care deeply about making better pathways for young people and for people of a lot of different identities and lived experiences. And there are people in the community, such as yourselves, who care about learning about and trying to make change in these areas too. So we need to encourage the good as well as part of these, as part of the path forward. So there is a group that I work with here in the GTA. And I did a study with them because I found them to be really so inspiring. It's more of a transdisciplinary group, a consortium called the Young Parents No Fixed Address Network. And so we've got
You're froze.
healthcare providers, frontline service workers, all sorts of different disciplines. There's social work and nursing and medicine, and really like a large policymakers, public health folks who are really trying to do work from more anti-oppressive lenses, trying to think through how they can provide information with each other to improve their services and supports in their work with young people, but also how they can maybe work as a community to change the systems that impact young people in such negative ways. So I did a bit of a study, and this was peak pandemic, where we really were in like the fullest form of lockdown. So I hosted Zoom-based interviews with amazing people from this consortium, just to understand like, well, what about like, what are you doing with young people that is more hopeful, because you do care about them and you are doing great work with them. So like, what are some of these nuggets of wisdom that we could maybe be putting out into both the academic and practice-based literature-based and practice-based to try to encourage more of this sort of thing. So tried to think about this from sort of more of a social capital, like who you know helps you navigate systems. The more people you know and the more connected you are to helpful resources and supports is generally shown to be a good thing for your outcomes, as well as just thinking about things from a more holistic reproductive justice lens. What are people who really do care about this, who young people would probably say like, no, that's someone who doesn't stigmatize, like that is a trusted person. That's someone who's like really trying to do the work in a good way. Well, what are they doing in their practice to try to amplify and improve young people's experiences? So this is just a tiny bit about this project, which will lead me into something else that I'm doing at UT right now. So I already mentioned this was just folks from the Young Parents No Fixed Address. I spoke with 10 of them, and just in basic Zoom-based qualitative interviews, just about understanding how they're helping people who are underhoused, with an emphasis on those who are pregnant and parenting, and from the work that they're doing from more anti-oppressive and reproductive justice lenses. They didn't get any money. They just did this to kind of advance knowledge and contribute back to how we can keep doing even better through our work. So I did all of these interviews myself, and then a beloved, amazing PhD student who works with me on lots of projects helped me to analyze the data. So we were everything that was collected through these interviews wasn't just maybe a figment of what I thought I was hearing, but like that another person was looking at the words and comments from someone else from the interviews that were collected, and making meaning of them, and trying to condense this into something that was a story that would capture more largely what people told us through these interviews. So just a bit about who we spoke with here. There were folks who represented social work, but in a range, frontline, shelter-based staff at different levels of experience. We spoke with people from nursing, midwives, and doulas, as well as someone from the field of medicine who is a physician. The years of experience ranged from 5 to 30 years in the field. It was overwhelmingly a sample that was more women and non-binary, and definitely if we could do this again or more expansively, we would not have such a white dominant sample. It was a sort of a sample of convenience, especially in the times that we were living. It was very complicated to do research. I think we're all a little overwhelmed at the time that we were doing this sort of research. So 8 out of 10 were white, 2 identified as Asian in the sample of the service providers. And I don't know if I'm going to read all of these, and my screen is slow to upload here. This is something that's been going on with the university, that some of the slides are not working are not populating very quickly. So I might need a minute because I don't know what it says unless it pops up. So there's an overview of results. I can skip around though. It might take a moment, but I can kind of go through in order because this is the first of the main ideas, but just the role that the practitioner plays in this work is really important. A lot of people in the sample said that one's own core values and their gut instincts, their commitment to this work is actually more important than the technical parts of what they do. It's kind of like how they show up and who they are in those moments is almost more important, if not distinctly more important than like, am I really good at, say, inserting an IUD, or am I really good at prescribing like the right kind of birth control in that moment, or doing something technical. It's just like how relationally people are addressing things in the moment. So someone's quote, which is what I chose to title this, my initial instinct is to listen. Sometimes, particularly in healthcare, we're so focused on our agenda or what we have to get done that we miss the opportunity to really hear from the individual what they think, what they want, and not perceive what their need is. I think listening gives us the opportunity to hear how the individual's framing their situation. And if we listen and hear that, we're best positioned to hopefully respond in a way that is meaningful and respectful and feels comfortable to a young person. A really example of that is using the language that the young person uses when you're speaking back to them. So if they say something in their words, you reflect on that and you show, oh, I'm using the words that you just used back to show you that I'm listening, and like, let's problem solve with this together, rather than, correct you or use different words or seem disinterested. And another thing they came up with the role of the practitioner is that just traditional education isn't enough. Lived experience, self-reflection, self-awareness really matters. So this was a doula who was part of the project as a participant in the research. And they said, I was always a doula. I was always helping friends who I grew up with in a very underserved neighborhood with lots of poverty. It's like thinking about the experience of supporting my friends through teenage pregnancy and navigating the system and dealing with child protection services really made me understand that this is a needed service. So really like that someone's lived experience prompted them to do this work, and that's like why they show up and continue to do this work in the way that they do every day, and in a way that can't replace any training that they could ever get anywhere else in some ways. So that was about more the individual, but it matters, like we're doing this work in a sense, in an organization and team-based sense. Most often we're very rarely working on our own. So it matters the culture that we're working in. So folks spoke about the importance of on-the-job training and mentorship and organizational commitment to doing this kind of work as well. I'd say the biggest is learning from other folks around me, a lot of role modeling, a lot of remembering that we're client-centered, remembering that we're trauma-informed, and see how that plays out in practice based on people who would supervise me, who have been colleagues, who've worked with complex clients or clients like the ones I was embarking on. It's just a lot of reflection on what works and that I've seen other people do successfully and work through. We have 3-hour meetings once a week to dive into client stuff and see how we can approach things differently. That's probably where my basis of learning has come from, to be honest. It's just like the chatting as a team and like, let's think through like what we could do better as an organization or as an entity, like more collectively brainstorming and supporting each other through those complex, like, I don't know what to do in this moment kinds of cases is really important to have that culture. So moving toward a more, a path of a proposed model of practice. This kind of came at, people had ideas at more of an individual level, like what I can be doing in the relational client-based sort of level. And then next, I would share that there's also stuff that we can be doing to change the systems that seem to continue to fail young people. So this quote is more about the individual level, cultivating meaningful and authentic relationships with clients. And in this case, clients are young people. I found this to be it's a long quote, but I think it was so impactful. And that's why I chose to include it here. Not to be judgy about their decisions. They might have 2 choices and both of them are bad. I think if you see the humanity, see them as an individual, not as a problem who walked into your office, then you have an opportunity to be one of those people who listens to them, even just validating where they're coming from, to say that must have been really difficult to decide how to make that choice, whether it be abortion or whatever. And we're here for you through all of it. Once they become a person, it becomes more difficult to hate. I'm not saying clinicians hate youth, but I think the judging probably comes off like that, like you're just another problem. It's a bit painful to do it. To have compassion is painful because the word itself, from the Latin to suffer with, because the word itself comes from the Latin to suffer with. I think if you truly have compassion, you're going to suffer with them a little bit and it's going to hurt. I think it's easier for people who are tired and stressed and miss out on the compassion because they're busy or because they don't want to hurt anymore because it hurts so much to suffer with. And so I also just want to close with advocating for structural change and systems navigation. So a lot of what people say that they do is not just sitting with people trying to help them problem solve at an individual level, but that people are going above and beyond their work to advocate for the very systems that seem so broken that they continue to kind of bang their heads against the wall and say, why do I keep seeing this issue in my practice? So they're showing up in other spaces to try to advocate for change, to kind of go to the source. So they don't see so many young people suffering in those ways per the last quote. So yes, we sit in the clinic room with an 18-year-old and we try to give them socks and underwear and a snack and grocery cards and tokens and taxi chits. We help to find them housing and parenting programs and whatever. We do all of that work, but we also sit at city tables at YPNFA, that's the Young Parents No Fixed Address Network, and hospital committees. We work to change the systems that are not working. We do a huge amount of work with non-insured issues. We're constantly banging our heads against hospital systems and issues for people with OHIP. We don't just be nice in the clinic room. So they're doing a lot of unpaid and extra above and beyond work to try to advocate at more systems and structural levels. And I think that's important because I think whether we're doing that frontline and direct practice work, there's a role for all of us to be doing some of that work. And I sense that this group is engaged in those efforts too. And it's just that's again, what's really inspiring and really great to see, because it does take a bit of a groundswell, both grassroots and grass tops, to be able to make these meaningful changes for people. So, I think that this is just important. Some people say that this work is like a calling, and that how they show up is actually more important than how good they are at even the technical aspects, which are important, of course, too. But it's how you are and how you can continue to show up in those conversations with young people matters a lot. That the culture that you work in can make a big difference in making change, but and also that it involves listening to people at an individual level, but also showing up for more macro kinds of structural change. So again, I just want to note that there are limitations. This was obviously a small sample size, and with some of the most inspiring people who I think are doing work in this space. So it's kind of like the paragon, the ideals of who's doing really, really amazing work. It was, not a particularly diverse sample in terms of race, in terms of gender identity, but there were people who have worked in the field for quite a bit of time to a very long time, and who are committed to doing work that I think defies what most of the research is about, and which says that young people have terrible experiences with service providers of all kinds. And I think that sadly is the majority of experiences, but we have to promote the good that's happening and the nuggets of wisdom that is happening in spaces where people are really committed to doing this work, and to do it really well. So we need to support that work, whether we're in those spaces, I think, as well. Whether or not we're working in those spaces, there's a lot we can be doing, even in passive advocacy, writing letters to our MPPs, showing up at meetings and spaces that certainly youth don't think are built always for them, but to take on issues that, even if it's maybe not impacting us ourselves directly, that being allies and building those relationships to create better conditions for young people and better outcomes for young people. We have a lot of opportunity to do that from wherever our social location or geographic location. So I'm just going to stop with that part now. There's another little part that I want to share after that, but I'll open it up to just like questions or comments or anything of that. Shannon, yeah.
Okay, sure. I guess this topic kind of hits home for me a little bit. I have two boys, but I end up sort of, I'd say, inheriting my two nieces from Austria, both traumatized. My sister's still in Austria, so I've been kind of their primary caregiver. They came to me 18 and, well, first 14, 18, and my one niece came 30 weeks pregnant. She was 20. So my youngest niece has mental health issues, addiction issues, just went through an ectopic pregnancy last month, had a pregnancy before that was terminated. The older one has a baby who's now 16 months, lived with me for a year. Through the end of the pregnancy, the first part of the pregnancy, she was living with me, and that's actually where I'm going to go babysit as soon as I finish this seminar. She also had an abortion at 16. So I've sort of seen through just my own family a lot of this youth, and they weren't homeless so much, but they were in a very traumatic situation, living in Vienna, Austria, with their father, and on the streets, a lot of drugs, gangs, drug dealing. Anyways, I really see the miracle, I guess I could say, but not to say I'm the best person around, because really I knew them since birth, and they're my family, of what strong, healthy, caring adults can do, because they've really turned their life around. And the one with the baby, it's a biracial baby. She was 20. She had a very complex delivery, ended up having an emergency C-section. And, really, she did not have a lot of understanding of anything going on. And really, they both would have been very, I think, challenged, not so much because they're homeless, because they're both basically living with me until my sister bought a house and they had the house, but I'm still supporting them there, is, challenging for accessing mental health services, addiction services, finding a childcare or a provider for a 30-week pregnant girl who doesn't even have health service insurance. She was from Austria. So all this stuff. And then, I'm living this whole reality of, and then my niece who just had an ectopic pregnancy last month had to have emergency surgery. So I'm living a lot of this youth with a lot of trauma, and two girls who've had a lot of reproductive issues. They're both doing better. They're both getting healthier. And the mom's been really, she was 20 years old, just about 21 when she had the baby, has really stepped up. She doesn't have a partner. So we don't really understand all the added layers of even a pregnancy at 16, 18, with all trauma background, and accessing abortion, accessing reproductive services. They are so very limited in their ability to advocate for themselves. And it's almost like having a senior. If you don't have somebody in your corner, it's a tough road. It's a very tough road. And it's just fortunate. I'm not only am I a healthcare worker, my husband's a pharmacist, so we had a lot of resources and ability to access, and people we could call into, and financial resources ourselves to help. But I tell you, it's scary to think about those other young, very young girls who are 16, 18, 20, pregnant. And I mean, these kids have graduated high school, have had work experience, so they would be very challenged to raise a child if they wouldn't have some supportive adults in their lives, and be able to support them. So kudos to people who are trying to help these young girls, because I see the baby now and she's doing great, and she's she probably would not have had the same outcome if I hate to say it, my husband and I weren't there to step in and really take that role on. as being a resource to them, and put a roof over their head, to be quite frank, for the 2 years I have. So
Thank you for sharing that. Yeah, I mean, I think that any supportive adult, but supportive others, like, and that's why I rooted I root everything of what I do in sort of the idea of social capital. Like, we're all strengthened by the people who we can go to for support, and whether that's emotional support, financial support, informational support, that matters a lot. And it seems to be the variable, whatever that looks like, as to like how your outcomes are, that these young folks have had you and support of others, is probably the difference maker. I've definitely worked with a lot of young people experiencing homelessness, really, like, as part of my dissertation work, my jaw was just like kind of on the floor as I was having some of these conversations with young people. It's like the myths that get endorsed when you don't have someone in your corner. Young people saying like, oh, I couldn't have an abortion, that would cost me $10,000. If I had $10,000, I'd have a car. And so there were like routinely young people who were self-inducing abortions, which is incredibly dangerous and so unnecessary, just because they didn't have someone they could ask, or didn't know where to ask or how to. And that was in the States, but we've seen aspects of that here. We see people not accessing contraception because they don't know where to start. Like, I don't have a doctor, so where do I go? I guess I just won't do it. I guess maybe that's just for someone else. And so then your outcomes, your whole life trajectory changes in some way. So yeah, the importance of others, like, we're all part of a collective, and a mutual aid and social capital are really, really important, and making sure that people have that, even if it's not family or friends and stuff. Yeah.
Well, it is, I think, generally understood that, well, we serve ourselves, and the privilege, if we're privileged, we get served first. And so we're really working. If I was a politician coming to your research, I want to hear the research is very valuable. That's going to sell legislative changes. Is the tax load 20 years down the road? Okay, so the longer we not teach these, like, some of these are just general skill sets of, is this person safe or not? Self-esteem, self-value, right? The other thing is really been successful is you can research those, the single girl who's 16 and pregnant when she's 45. So the surveying questions and how we engage the youth are the people that have walked those paths already and overcome are really powerful in terms of, I'm saying, totally directing the research. So, when I was in Chicago for a conference, and the speaker overcame a heroin addict mother in prostitution. And it was like pregnant, like, not in, we can't be in our right mind in that addiction, overcame that. And to look back at that and share his story about how powerful that is. And in Canada, I'd be curious from your perspective about, in Calgary, having forced, what do you call it? Snipping your tubes. Forced.
Oh, tubal ligation, like forced sterilization.
Yeah.
Mm-hmm.
So, I mean, that's pretty serious. So when we talked about in your great presentation, by the way, about stigma, it really came across clearly that the stigma is in the authority. So the teacher, the frontline worker, I was like the doctor. So if you go in to talk to a doctor, and I have to say, from my personal experience talking with youth, there's sometimes far more wise, like wise beyond, like, it's not comparable. I don't believe in ageism anymore. So how would you address, from an advocacy point of view, stigma in that authority layer? So I'm talking, hey, if the frontline doctors are struggling with generational concepts, or like that people can be lesbian now or gay, it's not a big deal. And hey, decide not to serve those people. How do you, I really believe in changing curriculum. So like, what are your ideas as actually advocating for change, and what would those changes be specifically?
Gosh, there's so many things,
Address stigma.
Yeah.
Stigma by a doctor. One
So,
doctor has a stigma.
So I think there are some things upstream that need to happen. We need to, at least from like a bigger structural policy lens, realize that we have to communicate things through a number of different ways, that ideologically, there are different ways to communicate with folks. So more progressive folks, you know, it's going to be like someone's lived experience, like hearing about that story and what someone's overcome, or like what their journey was, maybe more impactful. To some who are more, say, fiscally conservative, showing the cost benefit analysis of, you know, this is a terrible return on investment to make sure, you know, not give people the best chances that they have, to really,
absolutely,
you know,
as
to
a
really,
nation, as a fabric.
You know, it's like, it's more expensive for people to go through things that they don't want to go through, or that they're not ready to go through, or that weren't their choice to go through. It costs more money. And so if you can't see the humanity, then at least you can see the cost.
And it's not personal, it's a professional thing, and it's their stakeholder is legislation and the taxpayer, and that's the language we need to use.
So I would say that at a policy level, but in terms of dealing with judgy or stigmatizing providers, that's something that I'm getting more involved in my research, is doing a lot more with patient-centered tools. So not only thinking through providers, it's like developing tools that's like, you don't have to be this way. Like there are ways that you can consult a virtual community of practice. If you don't know what you're doing and say prescribing medication abortion, which is not hard. We have medication abortion here finally, as one, and this is just one example. But there are so many parallels to this across reproductive and sexual health. But it's like, you prescribe a pill, it's really safe. If you know what you're doing, you do it in that moment. You can have this whole virtual community of practice of other physicians and other healthcare providers walk you literally through what you're supposed to do in that moment. What are the risks? What are the benefits? Like, what are the things that you need to be thinking about as a provider? And you do it. It's not that hard. And to make things easier for those who are maybe hesitant, like I haven't done this as much before, but you know, someone's asking me for this, like, are there resources? Yes, there are. And I think also arming people who are our patients, our clients with, you know, you may be met with something that makes you feel like your questions aren't valid. So developing more tools that help patients and clients, especially young people, advocate for themselves in those clinical moments. So if you hear this, if they say, no, not going to help you, like, no, your question's invalid, or like, I'm not doing that. Like if they say this, you do this.
Well,
so I'm part of a project that's starting to develop more of this.
Oh, that's very fun.
Front of abortion in particular, but more on that soon in the next year.
Oh, that's very fun. Yeah, well, I like, this is a great question. Did any of these survey questions even address your issues?
Yeah,
you know, that's the feedback. You get feedback from your like who you're connecting with.
Yeah. Is there anything else that you'd like to add? Is usually the beginning of the interview.
And definitely like sample sizes, is that typical for research? Like,
so this was qualitative. These were interviews, and that is very normal for qualitative research. If I were to do a survey, then I would be more concerned about statistical power, and I wasn't trying to prove anything as it's like a significance, like a p-value saying like this is more likely or statistically more likely than this. So qualitative research will definitely be more verbal and more getting into the nuances of things. And we have so many issues, especially in healthcare and in working with equity deserving populations, that it's like, if we just said, oh, you know, we'll never have a big enough sample, I guess we can't study it, we would be just ignoring people's lived experiences. So it kind of depends on the question and the population. I've done a lot that's more qualitative and that's more like deep understanding through interviews and less people, because they would just be left out of research altogether, and they'd be squashed out of surveys because they weren't part of a big enough sample, or like they didn't fit parameters to be included. So both are super important. And I am an advocate and proponent of both, that like, yes, we need surveys that reach 5,000 people and we learn a lot from those, but then we can't be ignoring people with really specific needs and contexts just because there aren't 5,000 of them for us to reach through research. So we've got to do both.
Oh yeah, absolutely.
Mhm.
I'm an engineer. I do statistical analysis. So
Yeah,
I
that's where I started, but yeah, I realized that as some of the things I was looking at, they were more like outliers. And when I started to think about it more deeply, it's like social work in a lot of ways is in the business of outliers. So it's like, we're not going to see
Exactly.
someone come here and say like, oh, I've never heard of that before, I guess I can't help you. It's like, no, I have to help you because there's probably no one else who ever's tried to.
Yeah,
So,
great.
so
Thank
both
you.
are important. Yeah.
I guess Mina has her hand up,
Mhm.
Stephanie.
Mina, yeah, go for
Yeah,
it, Mina.
Hi, yeah, I just had a question about like what have you found to be effective in reaching youth with sound information? Because I've been listening and it's just been heartbreaking some of the stories that you've shared and how so many of the youth, many of them who are on the street don't have cell phones, they don't have access.
Mhm.
Is there an encouragement for them to go to the library? Like, what have you found effective to sort of get information in the hands of people who need the right information versus, oh, by the way, you can't do that because it costs a lot of money. So it's just
Yeah. Oh, there are a number of things. I was surprised in the US. I haven't gotten to know, in part just because I would usually be in shelters working with youth experiencing homelessness much more actively. I was so much in Denver, but then I haven't been allowed to in Canada as much because so much of the time that I've lived here has been pandemic and just like very different restrictions. So I have this like missing piece of the puzzle that I don't feel even like equipped to speak about things that I normally feel like I know a lot about because of the time frame that I've lived here. But I was always amazed by how many people, young people experiencing homelessness, did have access to cell phones. That they would and they told me this. I've actually done a number of different studies just about cell phone and technology use among the population. And though there is still distinctly a digital divide, it's not to negate that. Young people would say that they would trade things, that they would forego things that were basic necessities just to keep their cell phones going. Many of them, and I think it's not well understood, like most young people experiencing homelessness are actively in education programs of various kinds. They're working, they're incredibly busy. They are doing everything to try to keep things afloat. So that cell phone is the lifeline to like, that's my job, that's my work, that's my education, that's my only connection back to family, even if that's a fraught relationship. Like, they keep the lifeline open. So they might forgo food, they might forgo lots of things just to keep that going. That said, cell phones are hard to keep in service. They cost money, sometimes the service is fleeting, they get stolen, they get lost, they get broken, lots of issues with it, but a much higher percentage had things. So I think a lot of research went down the path for a while. And I think it was only semi well guided that they would try to reach folks intervention wise through different apps and different like kind of mobile technologies to limited results. Some were good, some were kind of not effective. I think there's an importance of breaking down myths that exist, because like if you don't hear from like a medically accurate source and you trust things that are on the internet or trust things that your friends tell you, it's a mix of accuracy. So having people who are able to communicate with young people in a really trust-filled way, and going to where young people are, not waiting for them to come to you, because it's often very hard for them to get to you because of transportation and costs and all these things. Bringing people who can build rapport, who can build trust, and bringing the information directly to young people where they are is really so important. And I think also not starting those conversations from a place of like an assumption that like you have no idea what you're talking about, so I'm here to educate you, like inviting the conversation, like opening the conversation. So what do you know about this? What are your thoughts on this? And like starting from sort of a different place, but popping up services where people are, where they're most likely to be, where they're most likely to find them convenient and more easily accessed and integrated into their daily lives is important. So that can look like education and information, and it can be the actual services. So I did a project back in Denver, again, as an example, that we're trying to reach young people and many different kinds of marginalizations. And we realized that having like little pop-up clinics where we could just provide information and services in, say, the context of a shelter, but with really cool people who were easy to talk to. And, we're just really like good at setting the stage for just, we're here if you want to know anything or talk about anything or whatever, and just like being very informal about it was really effective.
Thank you. That's great.
I think the Netherlands do a lot of jalopy going through the streets and having engaging people, or like magic school bus kind of idea.
Yeah, we kind of played with that idea in Colorado too. We didn't get there because of the pandemic, but yeah, even just making services accessible in different ways too. Like we did something with a clinic that I worked with a lot, and it's like making appointments that are available online so you don't have to talk to anyone, or making it possible to chat with your provider before you even go, so you can kind of vet them, like, oh, is this person kind of sketchy, or
oh,
is this
that's
person
nice.
kind of judgy? Like, I want to kind of get a sense so I know if I'm comfortable before I go, or like, can I bring a friend with me? And like being able to book an appointment where you can bring a buddy with you just for moral support, but then often the buddy asked about the services too, so it's great. And that's not what healthcare systems usually do. It's like you get your 15 minutes. You can't bring a friend. But like the friend is what makes me want to go, like makes me feel okay about going. So,
well, they're not saying no. You can't say no to someone saying, I want to bring a friend with me.
Yeah, they're not going to get seen though. So it's like that the appointment's not for them.
Oh yeah, but they're sitting with their friend.
Yeah, but I think like being open to like providing the service to the friend too, if they also wanted to ask, that was a really good thing that we found a lot of success from.
Is that that healthcare? Oh, sorry, Mina. Mina, do you still have your hand up?
I was going to ask if anybody else has a question, Charlotte. Yeah.
Only if other people have questions. I kind of just had a comment about BC. I'm in British Columbia. My husband's a pharmacist here, and in BC, we are the first province to actually get free contraception starting April 1st of this year. And scope practice for pharmacists is opening up May 1st, belatedly, to do some limited prescribing, but there's been some rumblings that actually pharmacists may end up starting to be one of those professions to be doing some of the, they already can do the after pill, like, within 72 hours without talking to the doctor. They're talking about pharmacists actually maybe even possibly being able to do the medical pill, I guess, right? That's in the works because they're going to be having limited medical scope of practice as well for prescribing. But BC is going to be the first province to have free birth control. That's IUDs without like any payment of any kind. That doesn't matter what age you are, what social and economic you have. One of the things in BC we've also found, and I don't know if other provinces are doing this, is primary care centers. And they're called primary urgent care. And that's where I took my nieces to, because they did not have family doctors. And in the case of my niece who was 30 weeks pregnant, I had to like get on the hop like immediately, get healthcare going. And they were exceptional, and they're still attached to them. And they generally work with a lot of youth, a lot of homeless, a lot of mental health addiction. They have on staff not just doctors, but primary care nurses. They have social workers. They have free counselors. And they were usually attached. And they within a day, I got an appointment with a doctor for her from the primary care, like who could assist with the rest of her pregnancy. By the way, she did not have, she was Canadian citizen, but did not have Canadian health care. So we had to pay for out of pocket. But it was very interesting. We went to the family doctor that they referred to because we were coming from, she was from Austria and going to have the baby here. The doctor was very, you talk about judging, thought she was coming over for a, what would you call it? Travel pregnancy, where you come in and have a baby and then leave again. We're feeling she came because she was in an abusive relationship. The partner was a drug dealer, and my sister and I basically escaped her out of Austria to come to Canada. And the doctor was super judgy with her, and she's only 20 and she's traumatized. She just came here like 2 days earlier from Austria. She's 30 weeks pregnant. And basically I stripped the doctor down. I was really upset with the doctor, how he treated her. And maybe because I'm a healthcare professional myself, I kind of stripped him down and said, this is not he's going on about how much it would cost. I said, cost doesn't matter. Safety is more important. If we have to pay $20,000 for this delivery, we'll pay it. He was super judgy about that. And because she was only 20 and of course she had a biracial baby on top of it. Yeah, but if you don't have an advocate that's strong enough to, these youth would shut down. She was crying after that appointment. And I went in the next day and next appointment, and I really stripped him down saying, this isn't the case. But the young people, they don't have the capacity to do that. And I wasn't afraid to do that because I've been a medical practitioner 30 years, but I was horrified how the doctor treated her. But the primary care were so caring and loving and understanding. But I tell you, doctors can be brutal with these young people.
We have to give that feedback somehow.
Thank you, Shannon. It's interesting because over the last few months, it's interesting how much BC is moving, not just in the healthcare field, but also in the wages field and everything. And I'm thinking, what's happening over there? What's the government doing that it's bringing all these things?
We have an NDP government. I don't know if that's anything to do with it.
Maybe we should keep a list. Does anybody else have any questions? How much more time do you need, Stephanie, to finish up? You have
I can just I'm not even going to pull up the slides, I don't think, but I was just going to say
because I do have
go ahead. Go for your question. I need just a second to show the other thing that I was going to talk about really quickly.
Okay, and then because if nobody's got anything, this question, it's interesting. I heard you say the words. I suspect I know what it means, but I thought I'm not going to be certain that I did. You said neurodiversities. I mean, diversities we've heard, the racial diversity, the sexual diversity, all that stuff, disability diversity. I have no clue what neurodiversity is. And can you give me an example?
Yeah, absolutely. And others may definitely chime in with ones that you know of as well. But I think of a really common one as being autism, for example.
ADHD.
Yeah. Others probably know many.
Mm-hmm. Cognitive issues.
Mm-hmm.
Thank you.
Anything that's maybe not like a physical disability in the sense that we think of a lot of physical. It's still physical, of course, but you may not be able to see it it's maybe not someone who's using a wheelchair, or maybe is not impaired in other dimensions. It's more of the neurological realm. Mm-hmm.
And interesting you say that, because when I hear Shannon's story, I mean, that was a situation or a circumstance type thing where the doctor made a judgment. And I'm sitting there going, the last thing you need is for a doctor who's seeing somebody and doesn't recognize that there is another diversity effect. Because it happened to me one time in my financial world, and I had never come across it. And I actually had to like Shannon did, I had to strip down a lender for money. How could you lend this person money when they have no clue what you're talking about? So, when you're talking about how to get standing. Thank you. Okay.
Yeah, absolutely. And just thinking about how we're sensitive with communicating, there are different ways of processing information that, that resonate with some people and don't resonate with others. So how we speak, are we really visual? Are we chronological in information and how it's delivered? There's so many factors that just making things accessible isn't just about the ways that we used to think about making things accessible. There's so much more to it. So we're really reaching and understanding and affirming people's different ways of learning and processing information. So much harder because you don't necessarily see the need until you realize that, like, oh, I've lost the person because I just explained this in a way that they maybe couldn't process. So just thinking through making all things more diversified and more accessible. And I think about this increasingly because in part because of this initiative, and I'm just going to share the screen for the visual so you can see the visual. In the beginning of the pandemic, and because of my love and commitment to young people and organizing young people, and young people really taking charge of issues that impact them the most. Toward the beginning of the pandemic, I had this idea for quite a while, but I wanted to develop a space for young people, really leveraging university resources and supports for good. Young people, I think, are often left out of, as I'd said earlier, decision-making, meaningful contributions or feedback on the systems that ultimately impact them the most. And like I'd said earlier, I think like we're always really surprised when it's like, why don't young people fare better with this? And it's like, well, you never asked them what they wanted in the first place. So of course it failed. And young people also, I think, really want to be involved in research and want the skill building opportunities to make those kinds of changes, to learn how to go about changing these systems, even with young people who have somehow navigated their way to higher education, until they have perhaps support of others, support of adults, support of other types of mentors, even peer mentors. They find that they don't necessarily have a foothold. You know, it's like you may have navigated your way to, say, U of T, but until you have a community and a place and your people and skills that you can build there, you're really at risk of falling out of those systems. And that's just the folks who come through our doors at U of T. That's not everyone else who's not even getting there. So providing opportunities for young people to like ask questions. If young people are asking questions, they're probably different than our questions as adults. So the whole conversation changes from the beginning. If you ask different questions, you're going to have a totally different conversation and different answers that result. So I developed, along with another faculty member at U of T, something that we've called the Youth Wellness Lab, and it's really been an opportunity. We've been just hustling around the last 3+ years, applying for grants and meaningfully trying to engage young people in different research projects, some of which they conceptualize and some of which are projects that we were leading anyway. And they're really excited about. They like the topic area and just want to join in and learn and be a part of the work. So this is a Youth Wellness Lab. It's these are some of the people who are involved. They're amazing. They all do happen to be young people of color. We're not solely restricting that everyone involved has to be a youth of color, but we certainly acknowledge that there are less opportunities for different communities and different racial identities to be involved in such opportunities. So we're really like a hub, combining academic researchers, young people, and community-based service providers in collective research. And we're looking at a number of different areas as well. And hopefully this will load for me, but our areas of focus, and you won't even see reproductive justice here, it would fall under health and mental health, but I would say that about half, at least, of the projects that we're working on now have some aspect to do with reproductive justice because of my involvement in the lab. And it's also been an issue that most young people really identify as super important to them and really viscerally exciting to be a part of. So we're engaged in a lot of different projects in that sphere, but we're thinking about things from involvement in public systems, housing and homelessness, neighborhood and community health, health and mental health, and resilience and thriving. So we've got projects kind of spanning all of these different areas, and we're housed at the Faculty of Social Work, where I'm a faculty member. Though most of what we do is virtual because we started that way, and we have young people who are from all over. So we're doing from all over the GTA, but it's hard. We realized something in the pandemic that while digital technology has its own issues with access, just physically getting places is hard. And that actually doing a lot of things virtually expands access for people, especially young people who are really busy or maybe have issues accessing transit, getting places around the city, especially if they live further outside of the downtown core. So we're doing a lot that's virtual. We're actually really rarely in the faculty of social work at the same time, but we've become a pretty tight-knit group of researchers. So we've done we've done so many things, but also in addition to a lot of reproductive justice work, racial disparities and child welfare. I do a lot of work that's arts-based in nature, thinking about photography and improv and storytelling and different things as ways of bringing communities together to advocate for change. And then young people, and training other young people how to become researchers, and how to involve themselves in research and social change initiatives. So that's probably all I wanted to say about that, actually. But you can check us out. We probably are the most active on Instagram. That seems to be where we disseminate most of our stuff. And we have a youth social media manager who does a lot with like making really amazing content that our whole team feeds into. But you can check us out if you're on Instagram. It's at Youth Wellness Lab. And we disseminate just different news about our projects and things that we care about there. And then we're doing more traditional things like academic publishing and conference presentations and leading research and data collection on a range of different stuff. So they're all really busy and they're really passionate, and I learn more from them than they learn from me. But yeah, if you're interested, you can kind of check out our efforts. We are still a little bit of a startup. I guess we're 3 years old now, but it's been a weird 3 years, as the world will tell you. So we're excited to be able to do more of our research again in more traditional ways.
Thank you,
I
Steph.
think that's all I had. Yeah.
I'm going to say that, yeah, we're coming to the end because we planned only for an hour and to an hour and a half. And I think the goal of this evening was to give a different aspect and to have, so perhaps projects that we could get involved in or things that we could do. And on that basis, I am going to actually give the last formal word to Shannon.
Oh boy, I get to talk a lot. You don't want me up on a stage.
We love you, Shannon.
Because I'm on the national board with BPW, and because our president is sick, I'm the current secretary. I'd like to thank Stephanie for her presentation. I've been 30 years, well, I don't know how, I'm getting old, so I think I'm pushing into 30 years as a BPW member. Started off in Regina, and then I went on to, we started we actually started with a virtual club about 15 years ago, and then an online club. So I've been past president of the online club. And so I was asked to give the formal thank you, but yeah, online is really let's say the pandemic has changed a lot of things. And I really encourage people who online advocacy, online education is so much more available than it used to be. And I think I have 4 young people in my lives, including my 2 sons and my two nieces, and they access things so much differently than what we do. I'm trying to educate my son, who's going for interviews, on the etiquette of emailing, because they don't even know how to email properly. And I think that we have to really, as a women's group, start shifting our thinking a little bit more of how we do our advocacy and how we do our education, and utilizing the tools that are out there because we want to our membership try to get more young people involved as well. And I think that seeing how your group is working that way towards, I do not know how to use Instagram, by the way, but yeah, so thank you so much for the presentation on a different perspective of reproductive justice with a youth focus, because it is probably an underserviced field. And my own experience personally with my own family members has really educated me a lot of what should be getting done. So thank you.
Yeah, thank you all for having me. This was great. I love to see when people are coming together to explore topics that they maybe have been impacted by firsthand, or maybe haven't really been as much, and that you're all trying to educate and learn and do something about this is really very inspiring. So it's really wonderful to meet you all.